Dear students, let us discuss the clinical importance of knee joint, especially in relation to a tear of the anterior cruciate ligament with anatomical explanation for it. Let us imagine a case scenario. A motorbike rider has fallen down from the moving motorcycle and injured his right knee. He complained sudden severe pain while standing. So this is the clinical case scenario which we are going to discuss to understand the importance of anterior cruciate ligament. During examination of the patient, so the doctor grasped the upper calf of the right lower limb with his dominant hand, that is the right hand, and then pulled it, the tibia, anteriorly, while keeping the other hand, that is the left hand, for stabilizing the distal femur. So when he pulled the tibia anteriorly with his right hand with a sudden firm forward movement to assess the laxity of the tibia. So in this case, the right tibia could be pulled very much forward on the femur, and this test is known as Lachman test for testing the integrity of the anterior cruciate ligament. So if there is a laxity of more than 6 to 8 millimeters shift from the normal, then it can be said there is the involvement of anterior cruciate ligament, that is injury of the anterior cruciate ligament. Now, after listening to the clinical case presentation with the observations while examining the patient, let us answer the following questions. 1. Which anatomical structure in the knee joint is ruptured? Then what is the appropriate investigation for the diagnosis? What is the anatomical explanation for this excessive forward movement of tibia on femur? Then, what are all the intracapsular structures of knee joint and their attachment to the upper surface of tibia? So now let us answer each of these questions. Now that I have already explained to you about the test that is performed, Lachman test, for the tear of anterior cruciate ligament, so it is easy for you to answer for this question. What is the anatomical structure in the knee joint that is ruptured? So the structure that is ruptured is the anterior cruciate ligament. So in this picture of the MRI, which is the appropriate investigation for the diagnosis of it, you can see the normal anterior cruciate ligament. How it will be And then when there is tear in the anterior cruciate ligament, you can see in this MRI picture, the arrows are indicating the tear in the anterior cruciate ligament. So now you know what is the cause and then what is the appropriate investigation. Now let us discuss the anatomical explanation for the excessive forward movement of tibia on femur. In this picture, you can see the lower end of femur, the upper end of tibia, and you can see the anterior cruciate ligament. This is the anterior cruciate ligament, and then behind it you are seeing the posterior cruciate ligaments. They are called cruciate ligaments because they are crossing one another like the letter X. So if you see this anterior cruciate ligament that is attached to the anterior part of intercondylar area of tibia. So it is attached to the anterior part. This is the anterior surface of tibia. So it's extending from the anterior part of intercondylar between the two condyles of the tibia and is running upwards, backwards and laterally. So it's running upwards, backwards and laterally, and it is getting attached to the medial surface of lateral femoral condyle. This is the lateral femoral condyle. So it's getting attached to the medial surface of this lateral femoral condyle. So that is the attachment of the anterior cruciate ligament. So further explanation for the excessive forward movement of tibia on femur is, if you look at the picture, you are seeing the attachment of anterior cruciate ligament and also the posterior cruciate ligament. This anterior cruciate ligament, it prevents posterior displacement of femur. So this anterior cruciate ligament prevents posterior displacement of femur. So when the knee joint is flexed, it will prevent the tibia from being pulled anteriorly. So when it is intact, this anterior cruciate ligament will prevent posterior displacement of femur, and when the knee joint is flexed, it prevents forward movement or the anterior movement of tibia. So in the present case scenario, there is rupture of this anterior cruciate ligament that is responsible for the excessive forward movement of tibia on femur. Hope you have understood the explanation for the excessive forward movement of tibia on femur in the present case scenario where there is rupture of anterior cruciate ligament. After discussing the case with an injury to the knee joint and examination of the patient wherein it was found out that there is a tear in the anterior cruciate ligament which was confirmed by the MRI picture, and after giving the anatomical explanation for the tear in the anterior cruciate ligament, now let us take a look at a question where it was asked to mention the intracapsular structures of knee joint that are attached to the upper surface of tibia. Now let us see the intracapsular structures that are attached to the upper surface of tibia are the two cruciate ligaments and the two menisci. So the two cruciate ligaments are the anterior and posterior cruciate ligament. We can see the anterior view and posterior view of a knee. That is the left knee you are seeing. And you can see the two menisci also. The medial and lateral menisci you are seeing between the lower ends of femur and upper end of tibia. Now let us see what are menisci, which are also intracapsular structures of knee joint. The menisci are crescent shaped plates of fibrocartilage that are placed between the lower end of femur, which is an articular surface, and upper end of tibia, another articular surface of the knee joint. And the medial meniscus, if you see in the picture, it is semilunar in shape and it has got an anterior horn and a posterior horn. The anterior horn is narrow, whereas the posterior horn is broad. And this is attached, that is the anterior horn and posterior horn both are attached to the intercondylar area. Coming to the lateral meniscus, it is semicircular in shape and it is having two horns like the medial meniscus, but both the horns are of equal size. If you see the picture, you can understand. And these two horns are also attached to the intercondylar area of the tibia. Now let us see the intracapsular structures of knee joint that are attached to the upper surface of tibia. In this picture, you can see the bone tibia, the upper end of it you are seeing, and this is the medial condyle and this is the lateral condyle, and then this is the intercondylar area. This is the intercondylar area. What you are seeing is the posterior surface of it, and then the attachments to the intercondylar area in relation with the upper surface of the tibia. The attachments you can see in this picture, and there is a mnemonic for remembering it. That is the Medical College, Lucknow, which can be also called as Lucknow Medical College. Take the first letter in each of these words. MCL followed by LMC, and in that order from anterior to posterior in the upper surface of the tibia. If you see them, you can see the anterior end of the medial meniscus. That is the anterior horn of the medial meniscus. Then next is the anterior cruciate ligament, the anterior horn of the lateral meniscus, then the posterior horn of the lateral meniscus, the posterior horn of the medial meniscus, then the posterior cruciate ligament, and this is the articular areas that will be in contact with the medial condyle of femur and the lateral condyle of femur. So that is about the structures on the upper end of the tibia within the capsule of the knee joint, that is the attachments of the medial and lateral menisci, that is their anterior and posterior horns, along with the anterior and posterior cruciate ligaments. So now let me review the mnemonic for remembering the intracapsular structures of knee joint or their attachments on the upper surface of the tibia. And for remembering these attachments, the cruciate ligaments and the horns of the menisci, that is the anterior and posterior horn of each meniscus to the upper surface of tibia from anterior to posterior, you should be able to represent by remembering the first letter in each of the words, that is the medical college, Lucknow Medical College, and wherein M and L are for the menisci and the C is for the cruciate ligaments. So again, look at the picture starting from the anterior to posterior. You can recollect the anterior horn of the medial meniscus, then the anterior cruciate ligament, the anterior horn of the lateral meniscus, followed by posterior horn of the lateral meniscus, then posterior horn of the medial meniscus, and posteriormost is the posterior cruciate ligament. Hope you have understood the importance of learning the knee joint, especially the intracapsular structures, and with the help of the clinical case scenario, you must have understood the attachment of the anterior cruciate ligament and its function in this small video.